Hello and welcome. Look, we know that caring for someone with ALS is a profound and, frankly, huge responsibility. Today, we're going to tackle one of the most complex parts of that job, managing all the medications. The whole point of this explainer is to give you a clear, manageable system that can help reduce the stress, avoid errors, and just let you feel more confident in the care you're providing. And let's just start right here, because this quote, it really gets to the absolute heart of it. What you're doing is so much more than just handing out pills on a schedule. You are orchestrating stability, you're preventing crises, you're supporting dignity in what can be a really unstable situation. Every single dose you manage is a direct act of support. So that's the real question, isn't it? It's not about being perfect, especially when you are just completely exhausted. It's about building a reliable process, a system that can catch you when you're not at your best. And that is exactly what we're going to build together today. Okay, so let's dive in. To manage these medications effectively, we first have to really understand their purpose in an ALS care plan. Because it's not just about treating the disease, it's truly about managing a life. So while there isn't a cure for ALS yet, the right medications are absolutely critical tools. You have some, like riluzole, that are designed to help slow the progression of the disease itself. But honestly, a huge part of the daily regimen is focused on managing the day-to-day symptoms. We're talking everything from muscle cramps and pain, all the way to anxiety. All of this is in service of that one most important goal, supporting comfort, dignity, and the best possible quality of life. Now, here's something that might be surprising. The single most important factor in preventing mistakes isn't having a perfect memory or somehow never feeling tired. It's having a strong, simple system that does the heavy lifting for you. So let's build that command center. And it really just boils down to these 3 core steps. Think of them as the foundation. First, a master list, which is going to be your single source of truth. Second, a structured schedule that creates a predictable daily rhythm. And third, using the right tools, the right organizers, to make it all visual and tangible. And this is what that master list can look like in practice. It's simple, it's clear, it's all in one place. You've got the medication, the dose, why they're taking it, and which doctor prescribed it. You have to think of this document as your lifeline, especially in an emergency. Keep a physical copy at home and a digital one, even just a photo, on your phone, so it's ready to share instantly with any doctor, pharmacist, or first responder. So once your command center is set up, what does the daily practice actually look like? Well, you need a simple, repeatable checklist for that moment you administer any medication. This is the habit that prevents the vast majority of common errors. And it all comes down to this number, 5. Committing these 5 rights to memory is one of the most powerful safety habits you can possibly build. And here they are. Before giving any medication, you do a quick mental scan. Am I giving this to the right patient? Is this the right medication from the bottle? Is this the right dose? Is it the right time of day? And am I using the right route? Is this by mouth or through a feeding tube? It takes just a few seconds, but it is an absolutely non-negotiable safety net. You know, a key challenge in ALS care is that the disease evolves, and that means your system has to evolve right along with it. One of the biggest changes is the difficulty with swallowing, which is known as dysphagia, and it directly impacts how you give medications. This slide really shows how that evolution plays out. In the earlier stages, you might be using liquid forms of meds or mixing crushed pills into something like applesauce. But when a feeding tube, a PEG tube, becomes necessary, the rules change, and they change dramatically. You have to flush the tube before and after, only crush pills you are absolutely sure are safe to crush, and this part is so critical. You have to administer the meds one at a time to prevent clogging and to make sure they get absorbed properly. And I really cannot stress this enough. Some medications, like time-release capsules, are specifically designed to dissolve slowly. If you crush them, you can release that entire dose all at once, which can be ineffective at best and downright dangerous at worst. So the rule is simple. If you are not 100% sure, you have to ask the pharmacist before you crush anything. As ALS progresses, that medication list often gets longer and longer. This leads to a common challenge called polypharmacy. It's just a term for using a lot of medications at once. And the more drugs you have in the system, the higher the risk of negative interactions and just overwhelming side effects. So how do you manage that risk? The key is to be proactive. You have to schedule a full medication review with a doctor or pharmacist every 3 to 6 months. And the most important question you can ask is this medication still serving its purpose? Using a single pharmacy helps a ton too, because their systems can automatically flag potential interactions. And please, don't be afraid to talk about deprescribing. That's just stopping a drug if its side effects are starting to outweigh its benefits. Okay, now let's talk about the person who is managing all of this. You. We focused on the technical system, but none of it works if we don't acknowledge the immense human effort and the emotional load that's involved here. This is the truth of it, right here. The constant vigilance, the weight of the responsibility, the fear of making a mistake, it all carries a significant mental weight. And you know what? Recognizing this isn't a weakness. It's the very first step to managing it effectively. If you've felt any of these, just know that you are not alone. This is the shared experience of caregiving. The fear of making an error, the 24/7 alertness, the interrupted sleep. It's a heavy, heavy load. The goal isn't to pretend these feelings don't exist, but to build a system that can support you through them. And this right here is the key mindset shift. You will be tired. You will be distracted. You simply cannot rely on being perfect every single moment of every single day. But what you can rely on is a consistent system. That checklist, that pill organizer, that alarm on your phone, the system is your safety net. So let this be your mantra. Give yourself grace. Trust your system. Because at the end of the day, it's consistency that creates safety for the person you're caring for and for you too. So as we close out, I want you to think about this. What is one small step you can take today? Maybe it's just starting that master list, or maybe it's just setting one phone alarm. Taking that very first step is the most powerful way to turn all this information into real peace of mind. Thank you so much for joining me.